Most people who have a stroke had no idea it was coming, not a whisper, not a warning. They went to bed feeling fine and woke up to a world that had shifted underneath them. But what if I told you that the warning was there all along, that your body had been sending signals for months, maybe years, and that one of the clearest signals of all lives in a place most doctors never even think to look? I've been practicing neurology and vascular medicine for 31 years. My name is Dr. Shigaki Hinohara. I trained in Kyoto, spent a decade at the National Cerebral and Cardiovascular Center in Suita, Japan, and I've spent the last 2 decades in clinical practice and research focused entirely on stroke prevention in aging populations. I'm not here to sell you anything. I'm here because of a man I met 23 years ago. A retired school teacher named Yoshida-san, 67 years old, sharp mind, grew vegetables in his garden, walked 3 kilometers every morning without fail. He came to see me because his wife had noticed something. When he spoke at dinner, certain sounds came out slightly wrong. Not slurred, just soft. Like a word had been gently folded at the edges. His tongue, she said, seemed to hesitate. He laughed it off, said he was tired. He had a massive ischemic stroke 4 months later. He survived, but he never spoke clearly again. That is the moment I became obsessed. I became obsessed with what I call pre-stroke oral signatures, the way the tongue begins to change months before the event. What I'm about to share is grounded in decades of clinical observation, confirmed by major research institutions, including a landmark 2019 study out of Osaka University tracking over 11,000 patients aged 60 and above. The study found that subtle tongue motor dysfunction could be detected through a simple 10-second assessment. These patients were 3.4 times more likely to experience a stroke within the following 18 months. 3.4 times, and the assessment itself takes 10 seconds. But before I show you, I need you to understand why this works. If you understand the mechanism, you'll take it seriously. It may be one of the most important 10 seconds of your life. The tongue is not just a muscle. It is a window into the brain's vascular health in a way that almost nothing else is. Think of your brain's blood supply like an irrigation system. Most of the pipes are buried deep. You can't see them. But certain plants with delicate root systems show you first when the pressure drops. The tongue is one of those plants. It is innervated by the hypoglossal nerve, which is exquisitely sensitive to changes in cerebral blood flow. When small vessels begin to narrow, the tongue starts to lose precision before the rest of the face or speech changes. This is the window. This is where the warning lives. This is your chance to identify the risk. The CDC reports that stroke is the 5th leading cause of death in the United States and the leading cause of long-term adult disability. Nearly 800,000 Americans experience a stroke every year. But there is a number that should stop you cold. Up to 80% of strokes are preventable if the risk is identified in time. 80%. Now, the assessment, 10 seconds. Do this right now or do it tonight before bed. Sit upright, relax your jaw. Now extend your tongue straight out, directly in front of you. Not to the side, straight forward, and hold it there for 5 full seconds. Keep it steady. Then, with your tongue still extended, move it deliberately to the right corner of your mouth. Hold for 2 seconds, then to the left. Hold for 2 seconds. Bring it back to center. That's it. You've completed the assessment. What you are looking for is this. Does the tongue drift? When you extend it out, does it pull slightly to one side? This is called tongue deviation, a documented early indicator of hypoglossal nerve compromise. The study found deviation in 61% of future stroke patients, but it was absent in 94% of the control group. Pay attention to these subtle signs. Your brain might be trying to tell you something vital. Take care. Does the movement feel effortful in a way it didn't used to? Not painful? Effortful. Like something that used to happen automatically is now requiring a quiet concentration you didn't have to spend before. Does one side lag? Right to left or left to right, is the movement equal? Or does it feel like dragging one foot slightly behind the other? If any of those things are true, I am not saying you are about to have a stroke. I am saying your body may be waving a flag. It deserves your attention, not panic. Attention. Let me pause here for a moment. Have you noticed any changes in the way you speak, swallow, or chew over the last 6 to 12 months? Even something small, a sound that comes out slightly wrong, a word that trips you up more than it used to? Type yes in the comments if any of this is resonating with you. I genuinely want to know, and I read them. Now here's what I wish more people asked me about: the connection between tongue health and stroke risk factors, the silent risk factors that drive stroke in adults over 60. Most people think stroke risk is about blood pressure. Hypertension is the single largest modifiable risk factor, present in nearly 77% of first-time stroke patients. But blood pressure is a number. It doesn't tell you what's happening in the small vessels feeding the brainstem. Those vessels are more susceptible to a process called cerebral small vessel disease. It is far more common than most people realize. Let's use an analogy. Think of a garden hose that's been left in the sun for too long. The outside looks exactly the same, but the inside has begun to stiffen, to crack microscopically, to lose the elasticity that allowed it to flex. That's what happens to small cerebral vessels with hypertension, diabetes, or high inflammation. They don't fail dramatically. They fail quietly over years in ways that rarely show up on a standard MRI, but they show up in the tongue earlier than anywhere else. This is a critical signal. A 2021 paper found that patients with small vessel disease scored significantly lower on tongue motor assessments. That gap between what the tongue knows and what the standard exam catches is where I've spent 31 years. There are other signals. I want to walk you through 3 of them. The first is swallowing hesitation. Not choking, just a momentary pause, a sensation like the throat needs a half second to remember what to do. Most people attribute it to aging or being tired. But when it appears consistently, it's a message. The swallowing reflex is coordinated by the nucleus tractus solitarius, buried in the medulla oblongata. It's directly adjacent to the territory most commonly affected in posterior circulation strokes. A 2020 review found that subtle swallowing dysfunction preceded stroke in 38% of patients. In almost every case, it seemed too small to bring to a doctor. But it is not too small. Pay attention to the quiet signals. Your body is talking to you. It's time to listen. The second is what I call the midnight numbness, a tingling or a strange flatness of sensation in the lips or the tip of the tongue. Not pain, just a muted quality, like pressing a finger against a table and not quite feeling the texture the way you used to. It doesn't happen during the day when you're busy and distracted. It waits. It finds you in the dark, when the house is quiet and you're lying still and there is nothing left to distract you from it. That tingling is not always innocent. The trigeminal nerve, which carries sensation from the face, lips, and anterior tongue, shares vascular territory with several key structures at risk in ischemic events. A 2018 study in the Journal of Neurology found that intermittent facial and oral tingling, even mild, even fleeting, was associated with a significantly elevated risk of TIA within 6 months in adults over 65 who had no prior neurological diagnosis. When it shows up in the lips and tongue together, at night, without obvious cause, write it down. Tell your doctor. Show them this video if it helps you explain it. Let that settle for just a moment, because I know some of you watching this are not thinking about yourselves right now. You're thinking about your mother, your father, the person who keeps saying, "I'm fine," when you know something is slightly, quietly not fine. That quiet dread of watching someone you love dismiss a warning you can't quite name, that is one of the hardest places to be, and it is exactly why I keep making these videos. The third signal, and this is the one I have never seen in a patient brochure, is what happens to the voice at its edges. Not the center of your speech, not words you're trying to say, but the sounds that live at the edges, the soft consonants, the S that used to be sharp and now sometimes comes out slightly diffuse, the precision at the end of a sentence that has quietly softened. Your partner may have noticed it before you did. Your children might have mentioned it once and let it go. It's not something that shows up on a hearing test or a basic neurological screen, but it shows up in research. A 2022 paper in Stroke, the Journal of the American Heart Association, found that acoustic analysis of speech in adults aged 60 to 80 could detect subtle articulatory changes associated with cerebrovascular risk up to 14 months before clinical diagnosis. 14 months. That is not a small window. That is an opportunity. Remember Yoshida-san, the school teacher I told you about at the beginning? His wife heard the soft consonants first, the slightly folded word at the edge of a sentence. She brought him to me, and I took it seriously, but not seriously enough. Not with the tools and the framework I have now. If I had done the tongue assessment that night, if I had asked the right questions about midnight numbness and morning swallowing hesitation, if I had listened the way I've learned to listen since then, I believe we could have intervened. I believe his story could have ended differently. I cannot give him that, but I can give you this information now, tonight, before anything happens. So here's what I want you to do. Tonight before you sleep, do the tongue assessment. Do it in front of a mirror. Extension, hold 5 seconds. Right, left, center. Watch for drift. Note the effort. If something feels different than it should, make a note of it. Do it again tomorrow morning. If you notice tongue deviation or morning swallowing hesitation, or that late-night tingling in the lips and tongue that appears when the house goes quiet, make an appointment. Ask specifically for a cerebrovascular risk assessment. Mention these signs by name. And if you know someone over 60 who keeps dismissing these things as aging, send them this video, not with pressure, just quietly. You might be giving them something they didn't know they needed. You don't have to wait for something to go wrong before you start paying attention. The body speaks before the crisis. It always has. The question is whether anyone is listening.